So precision today in CTV looks like, it's audience-led investment. We're really coupling, high quality CTV inventory along with privacy safe health and behavioral signals in order to deliver the messaging in the most relevant places. And along with that, the measurement is super important, making sure that the ad exposure is resonating in actual action because precision is not just about the reach, it's about delivering those outcomes.
Healthcare journeys are complex and unique naturally. So how can data and identity help brands engage patients with the right information at the right moment?
So the healthcare journey is not a linear journey. So data and identity really helps us gather signals across different environments, different, devices in order to really understand better that patient journey. So in understanding that patient journey better, we're able to deliver better messaging to make sure that it's relevant messaging to that point in time. Whether it's education, whether it's consideration or actually taking action, we don't want to be running the same ad over and over again. We want to be making sure that we're helping that audience through their journey, and in a complex space like healthcare, you have to make sure that we're doing this in a very data privacy, safe way, and making sure that we're delivering that messaging to ultimately help them to get to where they need.
So Diana, you talked about the need for privacy safe data. On the flip side, there's also a need and demand for personalization. So how do you approach personalization in such a highly regulated industry like health?
So obviously you have to be very careful within the health space, and we work very closely with our creative teams who are developing creative that's resonating with that audience in a way that it's more real to them. It's getting those messages to them that they really need. And we take that and couple it with the precision. And by taking that messaging and coupling it with the precision, you're really able to deliver that message in the right place, in the right time, in a privacy safe way.
A lot of the conversations around AI these days are somewhere at the opposite ends of the spectrum of hope and hype. Where is AI making the biggest difference right now in enabling smarter, more timely decisions?
So I would say within, optimization and decisioning, it's really helping break down those complex data sets and allowing us to make quicker data-led investment decisions in real time. And when you're dealing with a space like CTV that's very fragmented, being able to have that speed and agility is super important. So utilizing the AI to just make us smarter in different ways, it's not replacing the strategy at all. What it's allowing us to do is just smarter planning and smarter, in-flight optimization to be able to deliver that message in a real-time, quick way.
Dana, we're really in this kind of outcomes era where in the past awareness and eyeballs were sufficient, not anymore. So from an agency perspective, what does better outcomes really mean in healthcare marketing? And how is precision helping you get there?
So better outcomes is going beyond just media metrics, and it's actually delivering outcomes, real life outcomes. So when we take a step back and we think about where we started talking about this from precision, what we're able to do is, have that precision to reduce the waste. We're able to make sure that measurement is very important within the whole mix of things to make sure that we are taking that media exposure and making sure that it's actually delivering outcomes. So the outcome, again, media metrics are all important to us, but we really truly want to deliver upon whether that's education, whether that's, consideration and having somebody reach out to a doctor, have those conversations, or, eventually take action such as script lift. So the outcomes are super important, and, getting there in terms of the precision within CTV is really helping us to deliver all that.